Hello everyone, my name is Zaid. Thank you all for coming to my presentation on alternative treatments for depression. This issue at hand impacts a staggering amount of people, and I believe it just that we try to optimize our treatments for depression. I would like to welcome the Depression Clinical and Research Program at Massachusetts General Hospital, and I would like to personally welcome Dr. David Michelin, the director of this program. This is a brief overview of how this presentation is structured. We will start off by explaining the impact of depression in the United States and the current treatments. Then we will explain where the problem lies in its treatments. We will then talk about two processes, which are the role of neuronal clusters and the role of EEG analyses, which have been proven to be effective in supplementing treatments for depression. After we have explained that, we will talk about a plan of action and a budget breakdown, and afterwards we'll be here to answer any of your questions. Depression impacts over 260 million people worldwide, and in the United States it impacts over 17 million people. This amounts to about 7.1% of the population, which is a devastating amount. We can see on this graph presented by SAMHSA that in 2017, people in the age group of 18 to 25 are 2 times or more susceptible to depression than the age groups of 26 to 49 and 50 plus. The issue that this creates is that we see from a decline in mental health due to depression, we also see a decline in work performance. And we'll also see more cases of anhedonia, which is the inability to feel pleasure. And ultimately, we'll see an increase in the rate of suicide. The problem with current treatments of depression, such as antidepressants for example, over 2/3 of patients who are prescribed antidepressants are not cured from their depression. Once they stop taking their medication, they find that their depression still lingers. And another problem is that from antidepressants come dependence and addiction, which only serve to exacerbate the patient's depression. Now, we do see 1/3 of patients who are prescribed antidepressants who are able to achieve full remission. However, over 95 of those patients are stuck with anhedonia, which is the inability to feel pleasure from your life. They will be able to cure the depression and treat it effectively, but some of them will just be a hollow shell of how they used to be. The role of neuronal clusters has had sort of an uprising in the past few years as it pertains to treating depression. AGRP neurons, usually found under the base of the hypothalamus in the brain, have been found to be key in developing a novel way in treating depression. Now, in general, with patients who suffer from chronic depression, we see decreased levels of synaptic activity in their brain. However, upon closer examination, we have found that there's an abnormal increase in the synaptic activity around the AGRP neuronal cluster. Studies have found that if we were to inhibit the synaptic activity of these neurons, we would see a decrease in the severity of depression. Now, this study gives us the option to explore other neuronal clusters in the brain to see if it's linked to depression and to see if we can stimulate it to treat depression. As we look at electroencephalographic analyses, in the past few years we have determined that by examining EEG waves of patients who suffer from depression, we can test and identify which medications will work best for them. For example, sertraline, a commonly prescribed antidepressant, can be studied through EEG waves, and we can determine whether or not a patient will benefit it based on their EEG activity. If we look to the data on the right, we see that in our vehicle, 30 minutes after our 4-AP dose, a 4-AP dose is a sodium and calcium stimulant, which allows us to see more synaptic activity so that we can see more defined EEG waves. Now, 30 minutes after our 4-AP dose in our vehicle, we see scattered EEG waves. And with low amounts of sertraline, we also see the same thing. We see scattered EEG waves. However, if we increase the dosage in this patient to 2.5 milligrams per kilogram, we see a normalization of the EEG activity after 30 minutes of the 4-AP dose. So from these studies, we can determine which medications a patient will respond to best. And this will be beneficial for the overall treatment of depression. We can apply this with other prescriptions, and this will allow us to better treat patients and make sure that they are on the right medications to help treat their depression. So, our plan of action to combat anhedonia. Analyzing EEG waves can allow us to put patients on medications that they will have the best response to. This will allow patients who recover from depression to live a healthier and happier life. To combat the remission rates, we can look towards finding neuronal clusters, such as the AGRP cluster, and see how we can manipulate it to decrease the severity of depression or potentially eradicate it. So this is our budget breakdown. We would like to start with a one lab setup that communicates with various departments of the Massachusetts General Hospital. However, in the future, our aim is that depression clinics and research programs across the country will collaborate with us to find alternative treatments to depression. We will need a research lab at the Depression Clinical and Research Program, and that will cost about $6,337 in a month. Lab equipment that we will need is we need a MRI machine, but upon research we have found that your program carries that. A centrifuge is something we will also need, which will cost about $5,000, and this will allow us to analyze blood samples of patients and for animal testing. Culture cell equipment will also be needed for analyzing neuronal clusters. That will cost about $3,000. We will also need a vivarium with live mice, which will cost about $1,000, and this will help us in our animal trials. Now for staff, we will be employing undergraduates for volunteer work. However, we will need a lab manager on staff to oversee all production and processes. As we perform more research on depression and finding alternative ways to treat it, we can use neuronal clusters and EEG analyses to gain a better understanding of how depression works in the brain so that we are better prepared to treat it. For the 2/3 of patients who cannot achieve full remission of depression, we can find different ways to help them achieve full remission. For the 1/3 of patients that do achieve full remission, we can help them get rid and cure their anhedonia and allow them to live happier and healthier lives. This research in the long term will significantly reduce mortality rates due to depression in every country, and when paired with effective rehabilitation programs, will hopefully effectively neutralize the severity of this issue. Thank you for listening to my presentation. If you have any questions, feel free to reach me at 732-599-9243 or via email at zs215@scarlettmail.rutgers.edu. Thank you.